Hi guys, this is Alex from Salmonella Place. Today's pharmacology lecture is going to be on the drugs acting on the RAAS system. So the RAAS system, otherwise known as the Renin Angiotensin Aldosterone system, regulates the body fluid volumes, salt concentrations within the body, and the blood pressure. I'm just going to run through how this system works for you. Basically, the beta-1 receptors on the juxtaglomerular cells in the kidney, they sense a decrease in blood pressure within the kidney or a decrease in sodium chloride resorption in the macula densa, and they activate the renin secretion. Renin then converts angiotensinogen to angiotensin I, and then ACE, or the angiotensin converting enzyme, converts angiotensin I to angiotensin II. And then the three following steps occur. The slow pressor response, which is alternative or altered renal function. This occurs because of aldosterone release, which increases sodium absorption in the proximal tubules and increases potassium secretion, and renal vasoconstriction. Also, increased norepinephrine and sympathetic tone within the kidney. Then the rapid pressor response, which is altered peripheral resistance due to peripheral vasoconstriction, increased norepinephrine release and decreased uptake, which can cause increased sympathetic activity in the central nervous system, and it increases the vascular response. Also, catecholamine is released from the adrenal medulla. And the third stage is vascular and cardiac hypertrophy and remodeling. This brings about an altered cardiovascular structure due to the fact that there is increased proto-oncogene expression, increased growth factor and ECM synthesis, and increased cardiac afterload and vascular wall tension. Now, after these three steps have occurred, the angiotensin II receptors, there are two of them. Angiotensin I is G protein coupled, and that activates the sympathetic system, causes vasoconstriction and cell growth, and retention of sodium and water. Whereas angiotensin II has a limited action of vasodilation and anti-proliferation. So angiotensin I furthers the RAAS system and the effects it has upon the kidneys and the cardiovascular system, and angiotensin II limits the RAAS system. So it's like negative feedback. Now, let's go on to the drugs. There are 5 major groups. The first one is B1 receptor blockers. These affect the B1 receptors, which are found in the macula densa. They inhibit the renin release, and they're called atenolol and metoprolol. Second are renin inhibitors, called enalaquirin. Next, we have the ACE inhibitors, or the angiotensin converting enzyme inhibitors, captopril, enalapril, ramipril, and fosinapril. They treat cardiovascular disease, hypertension, cardiac failure, myocardial infarction, progressive renal failure, and diabetic neuropathy. Their side effects include hypertension, dry cough, hyperkalemia, acute renal failure. This is patients with bilateral renal artery stenosis. They are teratogenic, especially in the first trimester. They can cause skin rashes, angioneurotic edema, which is swelling in the mouth and throat, dysphagia, and neutropenia. They interact with some other drugs, including antacids, where they decrease the availability, and potassium-sparing diuretics. This can be counteracted by increasing the amount of calcium and potassium with supplements. Now we can go on to the fourth and fifth group, non-peptide angiotensin receptor antagonists, losartan and valsartan. They carry the side effects of uricosuriuria, hypertension, hyperkalemia, fetopathy, GI complaints, and headache. And finally, aldosterone receptor agonists to limit the aldosterone release, spironolactone. So that's all for the RAAS system. If you have any questions or comments, please leave them below this video and go to salmonellaplace.com for more pharmacology lectures. Thank you.